I tried to sign it. It says that the username and password is incorrect. I just remove all the projectile or something. Yeah. This one is Garcia 2.
Good afternoon, everyone. Thank you for joining us on our media briefing for Friday, May 15th. We have a guest from not within the county family, but a county partner, Salinas Valley Memorial Hospital, and we're going to get started with her. You've heard a lot on the briefing about health education with agricultural workers, and Brittany Sandoval, is a med-surg nurse at Salinas Valley Memorial Hospital. She's also involved with this ag education, health education, and she's here to tell us more about what goes on in the program and how it's being received. Hi, Brittany.
Hi, good afternoon, everyone. Thank you for having me. Like you said, my name is Brittany Sandoval. I'm a registered nurse with Salinas Valley Memorial Hospital. I have had the great opportunity of participating in this ag outreach. We get up every morning about 4 or 5 a.m. We're out in the fields with these crews, providing education on how to stay safe during the pandemic. We aim to provide relevant information to them, something that they can connect with. We like to start with a little bit of a debriefing about county numbers, the demographic that's being affected by COVID-19, as well as how to protect yourself while you're at work, while you're out in the public doing essential shopping, and how to protect your family when you come home. A lot of these individuals live in a household with a lot of other people, and so it's important that they understand how to protect their families, by washing their hands, wearing their masks, maintaining social distancing, as well as having a designated area in their house where they can remove their clothing, wash, and take a shower, and after that is when you can maybe sit on the couch and spend time with your family. So it's been very, very well received. A lot of these individuals, these farm workers, tractor drivers, packing employees are very gracious. They've been so gracious to us, and I'm very thankful that that SVMH has sent us out on this project to provide them with information. I think we've been able to quell a lot of fears that individuals have, and empower them a little bit more and help them to feel like they have a little bit of control in this situation. And I just want to take a moment to thank SVMH, the county, these ag companies, Growers Shippers Association, for really allowing us the opportunity to do this. All 4 of us, myself, Ivana, Flor, and Yesenia, we all have ties to ag. We come from ag families, and so I think this was something that was just really near and dear to our hearts.
Thank you, Brittany, very much. That's a great story. If you would mind staying on the line through the rest of our briefing, so if there are any questions from our media participants, you can answer them. Yes. Our next participant is Diana Jimenez. She is a Deputy Director of our Social Services Department, and she is here to tell us about the Great Plates Delivered Food Program that the county is launching. Hi, Diana. You'll need to unmute.
Okay. Hello again, good afternoon. Monterey County is pleased to announce the formation of the Great Plates Delivered program to support vulnerable seniors and local businesses during the COVID-19 crisis. Through the Great Plates Delivered program, the county will partner with local restaurants and food providers for home delivery of up to 3 nutritious meals a day, 7 days a week for adults, senior adults living in our community. These vital services will help support seniors to shelter in place. The program will also serve as an economic stimulus to help relieve some participating restaurants and workers that are struggling to just stay afloat during this pandemic. The selection of the food providers or restaurants will be determined based on criteria such as environmental health compliance, valid business licenses, certificate of insurance, ability to meet volume and nutritional standards, ability to source local produce and meats, ability to provide local jobs, location in low-income neighborhoods, ability to meet cultural needs, and location throughout the county. Restaurants that are already participating in a meal service program will not be eligible to participate, unfortunately, in the Great Plates Delivered program. And for seniors who are interested in participating and receiving the 3 meals a day kits, the criteria is they have to be 65 or older, or be between age of 60 and 64 at high risk of contracting COVID, or also be positive, COVID positive, or were exposed to COVID. They have to live alone or with another eligible adult, and they cannot be receiving assistance currently from CalFresh or Meals on Wheels, although the state is researching with FEMA if they will allow us to augment the lunch programs being offered through Meals on Wheels to supplement a breakfast and a dinner. So I'm hoping they say yes, but we're waiting for a response to that. Individuals also have to affirm inability to prepare or obtain meals. And what I received clarification today from the state that if we're asking seniors who are at risk of getting COVID to stay at home, shelter in place, then they probably are not going out to purchase food to prepare in home. So basically they're not able to prepare their own meals and therefore would qualify. Individuals or seniors, again, that are interested in enrolling in this program can call 211 and there will be an initial screening. Businesses interested in enrolling or being considered for this program, there's a 2-part process. The first is completing an interest application with the state, Cal OES. And the second part is then the county will send a separate application to all those that submitted an interest, and they'll complete that, send us some verification needed, and we will vet those restaurants to determine, again, which ones we will select, and ensuring, again, that they're spread out throughout the county to meet the needs of the seniors that we're hoping will enroll in this program and participate. Thank you.
Thank you, Diana. And if you would stay on the call for any questions from the press after our next couple of presentations. Next, we have Maria Pacheco. She is in the community benefits branch of the Department of Social Services. She's available. She's here to talk with us about CalFresh, which is another option and benefit for people, and how that is an update on how that and how it's being used. Hi, Maria. Do I have you, Maria? You know, I am not. I see her on the call, but I'm not seeing her on the screen. So I'm going to give her a chance to to connect. And we have Dr. Ed Moreno on the line now, and hopefully he will be able to give us just an update on public health and COVID issues. Hi, Dr. Moreno.
Hey, good afternoon, man. Good afternoon to everyone's on this meeting this afternoon. So Ed Moreno, Monterey County Health Officer and Director of Public Health. So this morning I just want to let people know that we're continuing to promote testing among our Monterey County residents. We have been asking for testing for weeks now, and we now have more testing thanks to California Department of Public Health and OptumServe, who's agreed to provide those services on behalf of the California Department of Public Health. Testing is really important for multiple reasons. One, from a public health perspective, is it begins to provide more data that we can start analyzing to get to provide information as how the virus is spreading in our community, who's getting infected, and how effective our efforts have been to slow down the spread of the virus in our community. It also provides us information that we can use in addition to other information to make decisions as to what activities could be released with some limitations so that our community can resume some activities that they haven't been able to do for a while. And that's important so that we have more information to make those decisions. It's also important for the general population, whether you're sick or not, to find out if you're infectious right now. Because if you test positive, then we in public health can give you information you need to know to isolate yourself so that you don't spread it to other people in your family or in your household or to your coworkers, for example. So that's how we as a community are going to continue to slow down the spread of this virus. So I just want to make sure that everyone is aware that we still have 2 sites and Optum sites, and you can go online or call in to schedule an appointment. We are working with the California Department of Public Health in that we are providing feedback to them. We're letting the Department of Public Health know of any challenges that we and our community members are having with the Optum site. This is a new service, and of course there are going to be things that go well and things that don't go as well as they should. So I do appreciate the feedback we've been getting from people who've gone to the site, people who've tried to call in, people who tried to go online. What are the challenges there? One of them is language access. So California Department of Public has heard that, and Optum is working to expand availability of languages, more readily availability of languages other than English, primarily Spanish, but then also looking at other ways to make appointment making easier for people who speak a language other than English and Spanish, particularly in Monterey County. And Elsa Jimenez, who's our Director of Health, is reaching out to media, Spanish language media, indigenous language outlets to make sure that we are, one, informing everyone in Monterey County of the testing availability, but also making sure that looking at ways that maybe we can assist individuals who don't have internet access, for example, or the other languages still aren't readily available through Optum, to assist in making some appointments for individuals. And this week I also sent out a health advisory. Those are notices that go out to healthcare providers throughout the county. Any doctor or other healthcare professional who's given us their contact information receives health advisories from time to time. So I sent that out this week, letting them know that I highly encourage them to refer their patients to Optum sites for testing, particularly if the healthcare provider doesn't have the swabs and the transport media to collect and send to a lab themselves. They can send the patient to the phone number or the website to get them signed up to get tested at these Optum sites. So I'm really hoping that our healthcare providers can can help us in getting more of their patients and their patients' families tested. And also a reminder to the healthcare providers that they are frontline individuals and that they too should be tested periodically to see if they have COVID-19 so they can take appropriate measures to prevent any of their staff from inadvertently spreading COVID to their patients or to their workers. So testing we're increasing testing, and we need people more people to get tested for the reasons I just shared. The other thing, unfortunately, I want to mention, I do want to mention that as well as once we get more testing, we're going to have more people diagnosed with COVID-19. So in anticipation of that, we continue to identify and train people who are to do to call people who have COVID, to isolate them, to identify who they were in close contact with, and then additional people working in public health to call those people, let them know they've been exposed and they need to quarantine themselves and how to quarantine themselves appropriately. So we're able to reach about 98% of people who have COVID-19 and 98% of people that are identified as being in close contact, which is a pretty high percentage. So, and in order to continue to have that level of success in getting people isolated and in quarantine, we're going to have to continue to increase the number of people to match the increased number of cases that we may be getting. Let's see, what type of individuals are getting COVID-19? Well, we continue to put demographic information on our website. There has been concern that I've heard some concern about a large percentage of Latinos, Hispanics that are represented among the those that are being identified as confirmed cases. At this point, I think I just want to share that the information is considered, we call it raw data, which means as soon as we have the data, we put it on the web. That information could change as we do further investigations about individuals. So that could change a little, and it does change from time to time from previous days, just because we get more information, we have to make adjustments to characteristics, which influences the numbers that appear in each of those demographic cells on our chart. One of the things that I think we're seeing is that there has been a tremendous outreach out of care and concern for our ag working families to get these individuals assessed if they're feeling they have symptoms, if they need medical care, try to get them in to get medical care, and also tested as necessary. So I think out of that extensive outreach, care and concern for ag workers' health, we have been seeing a lot more ag workers being tested for COVID-19. And as we expect, we've been seeing greater numbers of individuals testing positive because we have a lot more ag workers being tested. And so in addition to, so that would increase the number of ag workers that are people identified as being ag workers who have tested positive. In addition, we do have, when we do investigations and we call our ag workers who've been diagnosed with COVID-19, we do find that frequently the agricultural worker lives in a large household, which means that a greater number of people have been exposed to COVID-19, and some of those individuals in the larger households, eventually, while they're in quarantine, some of them do develop symptoms and are tested and diagnosed with COVID-19 as well. So we're seeing that contributes. They may not be ag workers, but often they're Latino, Hispanic, and so that further increases the number of Latinos and Hispanics represented among all of the COVID positive patients that we have in Monterey County. So we're continuing to look at this information, try to make sense of it, and share what we think is happening with you, the media, to share with the public. What does this all mean? I think it means that we're headed in the right direction, and we still need to have that continue to have that concern and care and concern for our ag workers. We do what we can as a community to make sure that they have access to healthcare when they're not feeling well, and get tested if they might have COVID-19 or think that they might have COVID-19. Next, I just want to point out on the data that I think we as a community, most people in Monterey County understand how covering our face works, understanding how staying at home unless you absolutely have to leave reduces our chance of getting exposed and coming down with COVID-19. And as a result, we have been able to slow the spread of COVID-19 compared to other counties in the state. So we overall, as a community and population, I think we've been doing a pretty good job. So on one hand, we've been able to release some activities. A few weeks ago, it was allowing all construction to resume. Some activities, outdoor activities that weren't allowed, were allowed to resume with some limitations like golf. And as a reminder, there was some restrictions released on home sales, home rentals, auto sales, auto rentals, for example, and also allowing for childcare to expand to, or the limitations on that allow for childcare to occur right now to expand to allow for summer camps for children this summer. So there's several things that have been released, and then most recently we've been able to release retailers to take orders by phone or online and to sell their products, their merchandise at curbside or delivery. So it's It's not releasing the entire county to go back as things were, but it does allow for many people to go back to work and allow for people to access services that they haven't recently been able to access as conveniently. With that, we do expect to see more individuals that are going out for additional reasons and possibly getting exposed. Even though they're wearing, covering their face, there's still a risk of some exposure when we're out there. So we do expect to continue to see cases and some deaths. Despite all the positive things that are going on, we do have deaths, and unfortunately, this afternoon we'll be adding 2 more deaths on Monterey County residents to the chart that we post on our web. And very sorry for those individuals and their families. What I can share with the media is that these were adults and they had underlying conditions that put them at greater risk for complications of COVID-19 and dying from COVID-19. So that'll be reflected also in the charts. But again, I'm very sorry for the families of these individuals. But we're doing I feel we're doing our best to try to do what's best for the entire community and allow us to have a little more flexibility and be able to get out and do more activities, knowing that we're doing our best at the same time to try to slow the spread and prevent as many deaths as possible. So I'll end there and give it back to you.
Thank you, Dr. Moreno. And again, our condolences to the families of the people that you just mentioned. I see we have Maria Pacheco from our Department of Social Services we've been finally able to connect with, and I'd like to let her go ahead and give an update on the CalFresh program. Hi, Maria. You'll need to unmute. Got it.
Hey,
Thank you.
this is Maria. I apologize. I am from the Department of Social Services, the Community Benefits Branch, and I would like to share that our 3 community benefits office remain open on a limited basis to our community. Applications can be submitted in person if people are still looking into stopping by the office. There is staffing there that can assist customers that are coming in and give them a telephone appointment so that an appointment can be scheduled over the phone. So the doors are open, limited. We're not turning anyone away. However, further interactions are being conducted mostly by telephone. I do want to share that applications can be submitted by online at See For Yourself or telephonically at our toll-free number. The CalFresh program requires, the program requirements for verifications are still need to be met. However, we are utilizing integrated system matches and exercising state-approved flexible measures to assist our applicants with gathering the required information. We're happy to report that mandatory reports such as the annual redetermination and semi-annual reports have been suspended, and this happened March and will continue through the end of May. Reports will resume in June. To further support our recipients, negative case actions have been suspended from April through June. Additionally, the state has issued a maximum allotment to families recipient of CalFresh for the period of April through June. On April 28th, online EBT purchasing was activated for EBT cardholders to make purchases at Walmart and Amazon. And in terms of Medi-Cal beneficiaries, also quite a bit of the suspensions and waivers that were applicable to CalFresh are applicable as well to Medi-Cal and the CalWorks programs.
Thank you, Maria. Thanks for joining us despite all the technical problems. I appreciate it very much. Now I'm going to go to some of the questions that we've gotten in on chat for our briefing. And Brittany, the first questions I have are for you.
Okay.
What is the biggest challenge in the education process for farm workers? The biggest challenge for you?
I think that the biggest challenge for us has been breaking down the barriers related to whether COVID is real or not. I think that a lot of individuals have this belief that because we haven't seen so many cases here in our county, like in other places like New York, they're doubtful. So I think that that's been a challenge that we've had, and that's why we like to include a little bit of a debriefing. We get our numbers from the county website. We let them know, okay, this is how many we have today. This is who's being affected. I think it makes it a lot more relatable. Other barriers, I think, is health literacy. Obviously, our understanding of health conditions and processes is different than these individuals. And so just tailoring the education to a way that's relatable and applicable for them has been a big challenge.
Thank you. And another question, you're up early with ag workers. Did you say you're going out to their workplaces, such as packing plants and fields?
Yes, yeah, we're out in the fields, in the packing plants. So we have to dress accordingly. We've got ourselves some rain boots the other day because we got rained on in Hollister. Really muddy conditions. It's a really humbling experience. Like I mentioned before, we're all from ag families, and it just gives us a new perspective on, every day, the conditions that they work in and the laborious, work that they're doing. It's backbreaking. It's incredible. And so, it's been really humbling getting up really early, being in the cold, and as soon as the sun is out and the clouds, kind of start to dissipate, we're in the hot heat. So we're pulling off layers, and it's been incredible.
Thank you. I have a question for Diana Jimenez on the Great Plates program. Diana, how many restaurants are signed up for the program, and how many seniors have signed up so far? Do you know?
Well, we barely informed the community about it on May 4th, and then started working on it on May 4th, and then sent out the press release. So as of today, there were a little over 50 restaurants that signed up through the county, through the state Cal OES website, and we've sent them all applications. Seniors, we've had about 30 as of a few days ago. So we're really concerned that seniors are not getting this information, or when they're going through the 211 tool, they're answering questions that may disqualify them when they really are qualified. For example, if they, one of the questions is, do you live alone? If they're sharing rent with somebody, living with somebody, to share expenses, they will say, or what we've seen is they say yes, but really they're independent, and the answer should be no, because their roommate is not preparing the meals for them. So we're trying to circle back to some of the seniors that we're aware of applied and were denied, to make sure that they absolutely do not qualify. So my suggestion, if you can help us with this, is spread the word for seniors who have applied and they were denied through the 211 tool, the screening sheet, that they give us a call, and they can contact Sandra Silva at 755-4728, and she will help reassess and help them complete the tool so that they're not erroneously denied.
Thank you, Diana. And Dr. Moreno, I have a question for you on testing. Since Wednesday, have more people been signing up for appointments at the Greenfield testing site, or is there still concern not enough people are doing so?
Oh yeah, so thanks, Matt. So I would say we have some good days and some not so good days when it comes to how many patients are showing up. So it varies from day to day. I can tell you, even on a good day, there's still capacity to schedule more appointments. So we really do need more people to sign up. And I know that when people go to sign up, they may want to sign up for one day, but if that day is full, they're given options for subsequent days and time slots. So if someone hears that maybe one day was full, maybe they can't they shouldn't make an appointment because they're not going to get one. You can get an appointment. It just may not be exactly the date and time you want it, but there's time slots and days that are offered to anyone who goes online. So please, the first step is just go online or call, and you can get an appointment. So please get out there and get tested.
Thank you, Dr. Moreno. And another question for you on contact tracing. How many, I think we've answered this question before, and I hope you have the number at top of mind. How many contact tracing people will the county need, and when will they be trained?
Right. So, yeah, so we're the governor's request of every jurisdiction is to have a certain amount of people to do the case investigation and the contact tracing. So for Monterey County, based on our population size, we are requested by the governor to have 65 individuals trained and performing that function or ready to do so. And so we're nearly there. We need about, I think, another 20 individuals, but we think we know where we're going to get those individuals. And we are signed up to have all of our staff eventually trained through the new statewide training modules that are coming out. I took a quick look at the training sessions, and from what I recall, there's, I think, 5 different sessions, and each session, I think, is 4 hours. So it's about 20 hours of total training time. I'll let people know that the folks that we have now doing that work have already been trained. There are other training modules that are out there from national public health agencies. So, and we have people who've been doing disease investigation for decades who are taking lead roles and training people, our own people, as they come on board. But what we'll be doing is retraining folks on the statewide standards so that we have some flexibility to have folks from the state hopefully join us and do some of that investigation and tracing. So their procedures will be the same as ours, because we'll all be following the same training as well. And so we'll be up to 65 hopefully soon. And in addition, we are also I've been fortunate enough to be able to have a demonstration of the state's proposed data management case and contact tracing data management system that is going to be is being rolled out with some pilot counties. So I was able to go watch a demonstration of it, how our staff will log in, how they'll see cases and contacts that are assigned to them, and they have the various tabs that they'll click to start entering information. There'll be uniform talking points that we'll all be following. So our Monterey County residents will be hearing the same from this very similar script. So we're consistent, so that as more and more people, unfortunately, more and more people get diagnosed with COVID-19, they're all hearing the same thing. So that will decrease the chance of confusion that one person with COVID-19 heard something from our public health workers, and then another person thought they heard something different. We'll have more consistency within the county and across counties as well. So we're really looking forward to that, and I think it's a great undertaking that the state is doing right now, and I'm pleased with the way I see so far, because we were able to. Some of my health officer colleagues from other counties have been actually working with the vendor on this to make sure that the final product meets our needs.
Thank you, Dr. Moreno. And another question for you in the testing topic, and you talked earlier about ag workers with increased testing. How are ag workers being tested with more frequency now than before, and when and where did that start?
I think it started with a variety of agencies realized the need to basically advocate for our people who are working in agriculture. So it was that included our county ag commissioner, some of the ag industry leaders, also some of our board members, board of supervisors were also very very involved in wanting to make sure that we are coming together to identify what the potential threat is to ag workers who often live in large groups and aggregate in congregate living settings, and what we can do to make sure that they are cared for when they need health care and are isolated and supported when they're in isolation if they test positive. So it was our hospitals, representatives came together. We've had nurses and doctors from our local hospitals and our county clinics and other clinics coming together and going to do education in the fields. So I probably left somebody out, and I'm sorry, but there's quite a few agencies or people within their agencies agreeing to allocate resources to work together on this.
Thank you. And now I've got some questions related to the fatalities that you announced a little while ago. Were the individuals who died of COVID-19 of a certain age range that you can provide? Also, did the deaths occur today? You're muted.
All right, yeah, thanks. The answer to the first question, yeah, they were in a certain age range, but because we fortunately only have 8 deaths so far in Monterey County, the number of deaths are too small to allow that would allow me to disclose any information about their ages. So, I hope we don't have too many more deaths, or the number of deaths that occur occurs at a low rate. But at some point, we might be able to start sharing more specific information about people who passed away. So all I can say is that they're adults, and I can't share. We don't share when an individual dies. We don't share names. We don't share addresses. We don't share anything or the date, including the day that they died, that might be used by individuals to figure out who it was. So I can't provide that information.
And Dr. Moreno, there was a follow-up question on the same topic about whether one of the deaths occurred at Salinas Valley Memorial Hospital, and I'm assuming that your previous answer applies.
Right. So again, as a public health practitioner, I'm proud to protect the privacy of individuals, whether it's COVID-19 or any other medical condition that someone dies from. I'm bound to protect the privacy. So thanks, Maya, but I can't share that.
Thank you. And Diana, I hope you're still on the line. I have a question regarding local seniors. Are there any estimate on how many local seniors might be able to qualify for the Great Plates program? And you discussed having seniors calling back and getting more information and seeing if they actually do qualify.
I was actually trying to get that data earlier today, but I don't have the numbers with me, like how many in Monterey County are of age 60 and above, and then of those, how many are currently on CalFresh. But what I know is that there's a lot of people going hungry in our communities, as we all know. Seniors are no exception, along with families. So we believe this program will help us address that need and that gap. And there is a higher threshold than the CalFresh threshold to qualify. So it's up to 74,940 for a single household and 101,460 for 2 household members. So it's really to also address the gap with the middle class that are also struggling. And, I just passed by on Thursday in my community, the food line waiting for food bank distributions. And, we see hundreds and hundreds of cars still lined up throughout the county. And again, it's different age groups, but seniors, again, are going hungry, and this program will help us help those vulnerable seniors. In addition, we can't save all the restaurants, but those that we can contract with, depending on the number of seniors that we're able to serve through this program, will help. So again, I don't have the numbers. I was trying to look that up for you, but I'll have to get back to you on the actual numbers that could qualify potentially. But again, if seniors have gone through the 211 screening tool and were denied because the way the questions are asked, it's either yes or no, and not too much as far as probing, like explaining, yes, I live with someone, but that someone is just a renter, or we're sharing rent, but they're not related to us. Or yes, that second person that lives with me is my grandchild who's under age 18. So that's why we want to probe a little more and suggesting that they call back or call us at the Department of Social Services, and specifically Sandra Silva, so that we can reassess their eligibility.
Thank you very much, Diana. And Dr. Moreno, I have a question for you circling back to outreach. Are there any additional educational outreach or education outreach, including bilingual public noticing at busy gathering places such as markets in the hardest hit Salinas area zip codes with the largest number of positive coronavirus cases?
So thank you, Maya. So I believe there are, and Elsa Jimenez, who's our Director of Health, has been organizing those discussions around that. So I have to defer to her. Unfortunately, I don't think she's on, but maybe that's something, Maya, that we could, Ms. Jimenez could get to us and then maybe share that with the media.
Thank you. And then I have a question for you on, don't go anywhere, contact tracing. How many people have been contacted and asked to quarantine as of now? And then additionally, with the additional deaths, do you also have an update on cases, or is the web report accurate at this time?
So I don't have unfortunately, I don't have the total available to me right now, but it's at least 1,600 individuals that have been identified as contacts to cases, and 97 to 98% of those individuals have been reached by our contact tracers. The other question was, Maya?
How many have asked to quarantine?
Oh, they've all been asked to quarantine. I'm sorry, but I'm sorry, I thought there was another part of that question.
Oh, yes. With the new information that you provided during the briefing, is the website accurate at this time, or will it be updated later?
So we update the website once a day towards the end of the day. What you have here is what was available as of. I'll have to look. But if anyone's interested, we always post the date that was updated. I believe this one was updated on the 13th, but so we wait for at least a full 24 hours. Yeah, as of May 13th, midnight. We wait at least a full 24 hours that passed, and then we post after those 24 hours have passed. So, it'll be updated this afternoon. And this is raw material. This is raw data. So often what we prefer to do in public health is to have some time, it could be a week or so, to go through this data, to clean it up, to make sure that the every case is accurately broken down into different demographics. But I just want to remind people that what we post this afternoon, even though it's clear a full 24 hours, our investigators, some of these people are still under investigation, which means they may say, well, when I went to the emergency department, I put that I live in King City. But then when we call them and confirm, they say, well, actually, I was just visiting King City when I felt sick. I actually live in Salinas. And so that's why some of these numbers will change as we continue with our investigation. So I just want to let people know some of this is raw data, so it tends to change from a little bit from day to day.
Thank you. And then I have another question in regards to the Optum site. Why are we scheduling appointments for testing when that may present a barrier to certain populations? There are some communities doing open testing where no appointments are necessary. Can you unmute?
Yeah, I'm not familiar with sites that are doing open testing. I'm not sure what that really means. What we have are healthcare providers who who are doing medical evaluations and deciding whether or not to test them for COVID-19. So if they're talking about emergency departments, yeah, you can go to emergency department without an appointment. Emergency departments will take anyone that feels they need to be evaluated. So technically, yeah, you can get evaluated and possibly tested without an appointment. The Optum sites are not there to provide a medical evaluation. They're there to allow our community to show up, to make an appointment. And the reason we have appointments is so we don't have everyone showing up at the same time with long lines, which makes it difficult to do social distancing. So they have appointments and they're given a 1 hour slot. And so several people will be given that same 1 hour slot. So they show up around the same time and we can continue with social distancing. I want to make sure people understand that there is a difference between going to a healthcare provider and getting tested and going to an Optum site and getting tested. If you go to a healthcare provider like I think Soledad Medical Clinic is swabbing people, and our 4 hospitals in the emergency departments are swabbing people as well. If you go to a healthcare provider, keep in mind that you're going to a healthcare provider, and what healthcare providers do, they do medical evaluations. So you will need to register as a patient. And then the healthcare provider will do a full assessment and decide whether or not any tests are required. One of those tests could be a COVID-19 test, in addition to a chest x-ray or a test for other viruses like influenza, for example. They might want to do blood tests. So they're going to do the level of medical evaluation that they feel they need to do as healthcare providers, and COVID-19 may be one of those tests. When you leave, you'll be leaving as a patient that checks out, which means that if you have insurance, your insurance is going to be billed. If you have Medi-Cal, Medi-Cal will be billed. If you have share costs, that's going to could be an issue for some people. So it's really important to understand that you're still going to seek medical care. And so where the Optum comes into play is that you're making an appointment, but you're not making an appointment for medical evaluation. You're making an appointment just to get tested. And right now in California, at this time, if you make an appointment and you go to an Optum site, you won't have to actually pay anything to get your test. And that's because you're not registering as a patient for a medical evaluation by a physician, for example. You're not sitting in a hospital or emergency room bed, which incurs a cost. You're not going to get lab tests, which incurs more costs. You're there for a test. So, and that's what you get. And if you have insurance, the Optum will bill your insurance, but won't take a copay. If you don't have insurance, the Optum has made arrangements with the state to cover that cost. So if you want to get tested and you don't want to necessarily get a physical exam and you don't want to get a medical bill, then Optum's the choice for you.
Thank you, Dr. Moreno. We've covered all the questions that have come in on chat, all the topics. Are there any questions that anyone would like to ask?
May I have a question?
Hi, Mark, go ahead.
Okay, thanks very much. Actually, a couple questions for Dr. Moreno. You've got the testing sites in Salinas and in Greenfield. What about a testing site for the Monterey Peninsula? And then second question is, we've seen some news reports about the administration wanting a vaccine, as soon as possible, hopefully by the end of the year. If a vaccine became available, how long, in your estimation, would it take to vaccinate every person in Monterey County? And would that predicate reopening everything in the county, that you'd have to have all 400,000 plus people in the county vaccinated before all of the shelter in place goes away?
Yes. Oh, so great question. Let's see. We've got 10 minutes. I'll do my best. So there's a lot in that question, Mark, but I appreciate it. So in terms of Optum site services in the Monterey Peninsula area, what I'll say is a little more generalized response, and that is that we know that we locally can decide where the Optum sites are set up. And so if we feel that we've basically expended all the opportunities to get people tested in one part of the county, we can request that Optum move its site to another part of the county. So that's something we are definitely looking at. So that said, while Optum is in Salinas, while Optum is in Greenfield, I really encourage people to go out and get tested now. because we may decide that there is a need to move one of those sites to another part of the county to make access available, to improve access for people who are further away from the Optum sites. So take advantage of it now, please. In terms of the vaccine and releasing restrictions, easing restrictions is going to depend on a variety of factors. It depends. Right now, we're relying on some factors and some data information to make those decisions. Moving forward, we still need some, I believe, and I may be wrong, but I believe that right now we could definitely benefit from having some type of surveillance in Monterey County that tells us what proportion of the population has been exposed to COVID-19. Having more viral testing results, I think, will help us get there. Eventually, though, I'm still interested in having an antibody test that reliably tests just for the COVID-19. I check every week with my lab director to see if there's anything out there right now. She's unaware of anyone that's testing for antibodies specific to COVID-19 in Monterey County, but hopefully we will get there. But the priority is still to test for the virus because we need to isolate people. Secondly, would be is the surveillance data. But right now we need to get people tested and isolated right now to control the spread. And we'll continue to work to trying to get some surveillance data to further inform us. And then finally, two more things before we get to the vaccine. Sorry, long answer. The treatment. So being able to treat individuals who are diagnosed with COVID-19 is going to have, I expect to have a benefit in that not only will people recover sooner, and not only will the likelihood of dying will be reduced if we have something that proves effective, but that will also give us some more confidence in the area of hospital surge, meaning right now, if a patient's hospitalized for COVID-19, there is no treatment for it and it has to run its course. And so the hospitals have to plan for that, having people in the hospital for 1, 2, or 3 weeks at a time with severe COVID-19. If we have a treatment that's relatively effective, the hospitals can take that into consideration and say, you know what, maybe we're actually better off with our surge plans now because hospitalization stays will be shorter, which means that people will leave sooner, which means we could possibly take more patients. So that's another benefit of having effective treatment. And finally, to your question, ultimately to the vaccine, and I made my way to the vaccine through all these other factors because I just want to point out to those that are listening, there's a lot of factors to consider in this ever-changing pandemic. But the vaccine itself, we have several researchers working on a vaccine, their own version of vaccine, and having a vaccine. Or knowing that we have a vaccine and can use a vaccine will have an impact, I believe, on the extent to which we can allow fewer restrictions in our community, but it also depends on the effectiveness of the vaccine. So that is something that the research trials are there for, to determine how effective it is. Ultimately, I imagine that we as a nation will arrive at maybe 1, 2, maybe 3 vaccines out of maybe 10 or 15 that are ultimately tried. And those are the ones that are going to be shown to be the most effective. Those are the ones we really should be focusing on and getting out to our community. So we really want to get to a place where we've got lots of vaccines, but we identified the best vaccines. And so play into the role of trying to get back to a place where we were before COVID-19.
All right. But if there was a vaccine that became available, a lot of people are going to want it, and they're going to want it right now. But realistically, how long could it take to vaccinate an entire county of 400,000 people?
Got it. Sorry, I left that last part out. So I can't tell you how long it's going to take. I can tell you that there are considerations that must be made. One is that we, unlike H1N1, with H1N1, we had at least 2 manufacturers who were already in the business of making flu vaccine. And so when we had H1N1, as soon as we identified the virus and identified the components of the virus that could be used to create new vaccines. That operation, that infrastructure went back into started up again with the new virus, and we were able to put out a vaccine relatively soon that was effective. What we have is we don't have the infrastructure like that to create a coronavirus vaccine. We don't have a coronavirus vaccine. And so we have to develop that infrastructure to create a coronavirus vaccine, which that infrastructure will likely be different than the flu vaccine infrastructure. So that's why we see the somewhat protracted estimates of how long it's going to take to get a flu vaccine, a COVID-19 vaccine. Once it is available, we'll have to wait and see how many manufacturers are going to be approved and how many vaccines they can put out every day. And then we'll have to see where we're at with COVID-19 in terms of vulnerable populations. Who is still vulnerable out there for dying from COVID-19? Who out there needs to be protected first to protect the rest of us? Such as first responders and healthcare workers. And those decisions, those questions are not new questions. That's where the similarities lie with H1N1. With H1N1, I and some other health officers worked with the state health officer back during H1N1 to make decisions, informed decisions as to where do those first batches of vaccine go, based on trying to do the greatest good and the greatest protection of public health with the small number of vaccines. So we're going to have similar conversations with our state health officer as well when those few COVID-19 vaccine batches are made available to California.
And Dr. Moreno, I'm going to try to squeeze in one more question before our hour is up. Why are Monterey County coronavirus cases taking longer to recover than those in other counties such as Santa Cruz and San Benito?
I would say it probably has to do with the way we're closing out cases. The true recovery rate is really the number of cases that we have in Monterey County minus the number of deaths. If you haven't died from COVID-19, then essentially you're recovering from COVID-19. So that's a big difference in the number of recovery, which I think we have 158 right now. So there's a big gap there between the number that haven't died and the number of recovered. So the difference there is basically closing out cases. So our staff, in order to get to 98%, in order to reach 98% of people who are infected and 98% of people who need to be quarantined, in order to do that, we really have to direct our team's efforts on calling these people, contacting them, getting them in isolation, and getting them in quarantine. So that's really where they're focused. The recovery is a statistic that is a lower priority to try to close out a case because if they close out a case and add another number to the recovered, that person's probably back at work already, and so it's a statistic at this point. But it's a statistic that a lot of communities and a lot of counties feel we need to put up there. So we'll continue to do our best to close out cases, and that number will slowly go up. But by all means, we're fully really focused on getting people isolated and in quarantine as soon as possible. That's our priority.
Thank you, Dr. Moreno. And we are now at 1 o'clock and our hour is up. Thanks everyone for joining our media briefing today. Our next briefing is on Monday. See you then.
Thank you, ma'am.
Thank you.
Awesome job. Awesome. Now, I'll send you guys a link of